So it's sharp 5 and we are live now. So with all your due permission, shall we begin with the session?
Yes,
Thank you so much, sir. Good evening, everyone. This is Batul from IGCP, the moderator for today's session, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by our renowned stalwart who is present here with us today. Before moving on to the topic for today, let me introduce the topic and our renowned expert who is here with us. Well, he is none other than a very renowned HIV specialist, Dr. Ketan Ranfaria, sir. Sir is HIV/AIDS consultant at HIV/AIDS Clinic, Surat, Gujarat. With Sir's wonderful insights and with his tremendous experience, we are going to talk about the topic for today, which is frequently asked questions for individuals living with HIV on this occasion of World AIDS Vaccine Day. So now, before moving on to the topic, let's have a brief look on what the topic says with Sir's wonderful insights. So I am very delightful and with very delightment, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. Sir, over to you.
thank you very much for introductions. And let's start our today's topics and welcome everybody. Our topic is frequently asked questions by HIV patients. So first of all, we're starting with scenarios that one someone is newly diagnosed HIV positives. So what should be the immediate concerns and the understandings of HIV by the HIV positive patients? So first and foremost, patients questions come in patient's mind that will I die or will I live? So what will be the my life expectancy? Is it possible to live with HIV or it is a like a death sentence? So today's in ART era, the life expectancy of the HIV positive patient is as good as a HIV negative patients. So right now, the HIV is no more death sentence, and a long and healthy life is possible with the treatment. Treatments means the ART, antiretroviral therapy, and life expectancy is similar to those without HIV. But for a normal and the normal healthy life, uh, foremost important thing is early diagnosis and the right treatment. So that is a key to maximize HIV positive patients' health and well-being. So another questions come in the HIV positive patients' minds. How I got HIV? I don't know. Many times the patients feel that I didn't have any special high risk exposures or behaviors. So let's understand the which key route of HIV transmissions. One is the blood. Second, semen. Third, vaginal fluid. Fourth, anal fluids. And the fifth, breast milk. So these are the body fluids that can transmit HIV from the HIV positive person to the negative persons. And the commonest routes are the saline needles and the unprotected sex. But many times the patients ask, Sir, can you tell me by which routes I got HIV? And the second foremost ask questions. When did I receive when I did when did I infected with HIV? But unfortunately also, there is no any test that can depict the by which way HIV enter into that person's body. And approximately we can judge that HIV infection is a new or old, but definitely we cannot say the HIV in the body since how long. So these are the two main questions, but the answer will be unanswered. They will remain unanswered. And the next questions will ask, what should be my next step? And these are very crucial. Taking charge of your health. And for that, person should contact the HIV positive. Whenever the HIV positive persons for getting treatments, try to contact the HIV experts persons. So find a specialist, connect with HIV specialist doctors, and then which type of the treatment is best for HIV positive persons? And the answer is it's ART. That means antiretroviral therapy. And when should start? It should start with as soon as possible. And after that, regular checkup for monitoring and support is also very important thing. Let's learn some HIV and its basics that every HIV positive patient should know. Understanding the stage of HIV infections, your journey to wellness. Whenever someone get HIV diagnosis, person's minds come in which stage I am. So let's learn the stages of HIV. First is acute HIV infections. It is initial days, initial 6 months of HIV infections. Second is a chronic HIV infections. That is an asymptomatic phase, and this stage lasts for rather many years. And most of times, in typical scenario, it is last for around 7 to 8 years. And the last stage, stage 3, is AIDS. In acute HIV infections, person have viral-like infections or symptoms like fever, chills, sore throats, fatigue, body ache, night sweats, rashes, and swollen lymph nodes and mouth ulcers. But this acute stage lasts for very short periods, like 6 months. And chronic HIV infections, it is mostly it is asymptomatic, and swollen lymph nodes may be present. And this chronic HIV infections, it's a asymptomatic phase, and that can last for 7 to 8 years in the most of patients. But if still persons are not on treatment, then and then that persons will develop stage 3, that's known as AIDS. AIDS defined by the 3 conditions. First, person should be HIV positive, person should have HIV reports positive. Second, CD4 count should be less than 200. And third, some opportunity infections and 1 out of 60s, that is defined by WHO. So if someone has 3 conditions, HIV positive, CD4 less than 200, and the opportunity infections, serious opportunity infections, that person will known as a AIDS patients. But those who don't take a treatment, that person will develop AIDS. Same way, those who are taking the antiretroviral therapy, person will not develop AIDS. So, what is HIV progressions? Understanding the different paths. That is in different acute phase. In that acute phase, the CD4 count will go down and the viral load will steeply rise. After it will settles, it will come as chronic HIV phase. Gradually, CD4 count will decreasing and the virus, number of the virus in the blood is increasing. In the last AIDS phase, the viral load will be very high and the CD4 will be minimum. So let's understand the step by step all the progressions. In the typical progressions, the gradual decline of the immunity, that means the CD4 counts over 7 to 8 years, and after 7 to 8 years, person will develop AIDS. And the 70% of HIV positive patients will fall in this category. Second category is of fast progressions, rapidly progressions to AIDS within 2 to 3 years, and approximately 10% HIV positive patients fall in this category. Third is a slow progressions, that is a kind of the natural controls without any kind of the medications or treatment. Patient will remain asymptomatic for more than 10 to 15 years, and approximately 10% HIV positive patients fall into the slow progressions category. Fourth and the last is the known progressions, or also known as elite controllers, maintain undetectable viral loads and the healthy immune systems, that means the more than CD4 count more than 500 without any kind of the treatments. But in these categories, approximately 1 to 2% are non-progressive or the elite controllers. But what is the key message here? Early treatments can dramatically help you to stay healthy. Let's learn about the CD4 count. What is CD4 counts? That is a key measure of your immune health systems. CD4 count is a immune system soldiers. That is a white cells that fight against infections. In normal situations, HIV virus target this CD4 count and weaken our immune system. Our CD4 counts matters. So, how well your immune system is working? If your CD4 count is normal, that means the in between the 400 to 500, that means immunity is a normal. A CD4 counts regular monitoring will help to track the treatment effectiveness of the treatment. And what is our goal of treatment? To increase and maintain the CD4 count. And how we can define the HIV stage according to CD4 count. So there we can divide the stages in the three parts: stage 1, stage 2, and stage 3. If the CD4 count is more than 500, that means early HIV infections. If CD4 count in between 200 to the 499, that is stage 2, intermediate HIV infections. And if CD4 count is below 200, that means it's stage 3, advanced HIV infections or AIDS. Understanding the viral load. Why it is very crucial to understand and regularly monitoring of our HIV treatment. So what is meaning of the viral load? That's measure number of HIV virus in 1 milliliter of blood. And our goal of treatment is reduce the viral load to the undetectable level. Undetectable does not mean the person got cured, but undetectable level means HIV number of the HIV virus in the blood is so low that laboratory machines cannot detect it. And our target is we should reach the viral load to the undetectable level. Undetectable means virus is suppressed and cannot transmit sexually, and U is equal to U. So what is this? U is equal to U. That means undetectable is equal to untransmittables. So when viral load less than 200 per ml in the blood, that means the HIV virus cannot transmit from the HIV positive person to the HIV negative persons, even without a condoms or without any protections. So regular monitoring, it is important to track our effectiveness of HIV treatment. Viral load levels and what is the understanding the levels and the stages. In different stages, the viral load will differ. In the stage 1, the viral load will be low. In stage 2, viral load in between the 10,000 to 1 lakhs. And in the stage 3, viral load will be more than 1 lakhs. So we can define the viral loads by these different levels. Undetectables means the very less virus, 20 to 50 copies per ml. That should be our target for our HIV treatment. Low, if viral load is less than 10,000 copies per ml, we will define its low viral load. If viral load is in between 10,000 to 1 lakhs copies per ml, we will define it's a medium viral load. And if viral load is more than 1 lakhs copies per ml, we will define it's a high viral loads. How to manage HIV treatment according to the capacity or paying capacity of the persons. So affording your treatment resources in India. The both kind of the treatment is available in India. Those who can afford the HIV medicine in the private sectors, it's available. But for those who cannot spend the money from their pocket. There is also free HIV treatments available in India. I will explain in details in the coming slides. Let's first of all see the free ART treatments. So free ART treatments is available through the government programs. That's and the apex body is the NACO, National AIDS Control Organizations, providing the free medications and care through the ART centers. And this ART centers is located at medical college. That can be the private medical college or government medical college or district hospitals. In India currently, more than 713 ART centers are working across the India. And each and every district, at least one ART center is there, but in many districts, more than one ART center is working. And other than the free ART medications, the state aid societies offer additional supports and the resources to HIV positive patients. And we can also help to connect you these services and guide through this process. So those who want to take ART medicines from the government, but they don't know how to proceed further and how to go, then in that case we can help to what is the process where you can got registrations and how what is the process of for registrations in the ART centers. But for those who are uh, affording and they don't want to take a treatment in the government hospitals and able to pay for their HIV treatments, the option is available in the private sectors also. So costs vary from many factors influencing the cost of the private cares. But in our own clinics, there is a plan 1, 2, 3, 4, and all plans at as low as the 1,000 per month cost to the 2,500 per month. So different on the different kind of the medications and the different stage and the different kind of the patients and number of the pills per day, the treatment cost can be vary. And we also provide transparency and discuss all the cost upfront and find the best plan for the patients. And never hesitate to talk to us about your financial concerns or to any of your doctors because doctors can offer you another cheaper options might be something with a different company or with a different product. Let's we talk about the ART medicines, antiretroviral therapy medicines. It's allopathy medicines. And currently, according to the WHO, World Health Organizations, and the CDC, Center for Disease Control Organizations, and NACO, National AIDS Control Organizations, currently only allopathy medicines can control the HIV infections. So I request all the HIV positive patients, please keep your treatment along with allopathy only. So, power of the adherence, regularity of the HIV medications, it is extremely important in the HIV treatment because it is a virus. So, if you don't take a medicines on timely basis, there is risk associated with the treatment failure. And we will understand this in these slides. Consistent level. To maintain the constant level of the HIV medicine in your blood, you must take the HIV or HIV medicines on the time to keep the virus under control, suppress undetectables. You must take the HIV medicines on time without fail and don't miss it. If you don't take medicines on timely basis, the HIV virus can learn that how to fight against HIV or HIV medicines, and that is known as a resistance. And if once HIV resistance develop against your HIV medications, your medicine will stop working, then you have only one option. You have to switch from the first line ART medicines to second line ART medicines and second line ART medicines to third line ART medicines. And that will increase your cost of medications, number of pill, increase the side effect of the medications. So please stay on path and don't miss your HIV medications. And it is also important to protect your health because if you take HIV medications regularly, that will help to maintain your immunity. That will help to maintain your CD4 count in between 400 to 500, and sorry, 400 to 1500s, and that will fight against the different kind of the infections, and you will be free from the other infections, opportunistic infections. We can help you to make a strategy and support for your constant adherence. So, which kind of the prophylaxis and the vaccinations are also important for HIV positive patients? And first of all, I will let you know what is the prophylaxis. Prophylaxis means any kind of the medications that give to prevent certain kind of the conditions or infections. And the vaccination is to prevent the disease. So most of HIV positive patients also receive this kind of the co-triamoxazole antibiotics. So how these co-triamoxazole antibiotics help you and what is the purpose of these medications? Let's understand. These medications preventative medications that protect against opportunistic infections, infections that can affect your guts, your lungs, or your brain. Because in the HIV, weaken immunities, HIV makes you more susceptible to certain infections, and especially for your brains, your lungs, and for guts. So these medications target the bacteria and protozoa. So when you should start this antibiotics, go back to or the supplements like the medicines. So it's based on the CD4 counts. Usually, when your CD4 count is less than 350, you have to start or in the stage 3 and 4, stage 4 conditions like the tuberculosis. And when you have to stop, once your this tuberculosis or other major disease cure or when your CD4 counts goes up and more than 350, 350s. And daily once a daily medicines you have to take. So safeguarding your lungs, TB preventions for people of living with HIV. So this another medications is also used to prevent the tuberculosis because we already know the HIV decrease the immunities that is more susceptible for the TB infections. So this isoniazid tablets daily one for 6 months that will help to prevent the reactivations of the tuberculosis bacteria. And that medications will stop the latent TB to becoming active TB. So, irrespective of your CD4 counts and irrespective of the clinical stage, each and every patient should go take this isoniazid prophylaxis for TB preventions. Vaccinations. Some vaccinations should be advised for all the TB HIV positive patients that will help you to build immunity against the certain infections like the influenza, pneumococcal, hepatitis A, and hepatitis B. TDAP is like for the tetanus, diphtheria, and pertussis. That is a single injections containing all the three vaccines. Let's talk about the treatment and the health management. When should we start the HIV treatment? As soon as possible. You should not delay the HIV treatment to wait for the symptoms, and you should not wait for the symptoms, and you should not wait to decrease your CD4 count. Because if you start the HIV treatment early, that will protect your health and prevent immunity further going down, and that will help you to achieve the U is equal to U. That means undetectable is equal to untransmittables. That will help you to prevent your partners getting HIV. Why ART should use and why we should not use any other kind of the therapy, and what is the science behind the HIV treatment? Because it's a proven effectiveness treatments currently more than the 3 crores people are on the ART medicines. With these medicines, you can reduce their HIV viral loads level to the undetectables, and that will help you to untransmittables motto. That will improve your quality of the life, prevent the complications, and prevent the other diseases associated with AIDS. It is the safest and the most effective medicines as per the many clinical trials. What can be the HIV medications and the side effects? So common side effect can be a diarrhea, headache, vertigo, vomitings, and fevers. But you should not worry. Everyone will not get these side effects. Only 10 to 10 to 12% patients will get these side effects, and even those 12% patients will get relief from all these side effects as the patient's medicine will go on. Another questions most of patients ask, can I take other disease medications along with HIV medications? So yes, more than 99% other medications you can take along with the HIV medications, and rarely some medications you should take at a different time, or in the extremely rare case you need to change your medications. Can I take HIV medications along with alcohols, and what kind of the diet I should change, and what is very important for well-being? So balanced diet is a key. Focus on nutrition and the whole foods. Alcohol, best to avoid, but if you cannot avoid completely, you should take it alcohol in the moderations. And if you are you are habitually taking the alcohol frequently, then we will advise you take the HIV medications on different times. Like if you are taking the alcohol in the evening times, you should take your medications daily on the morning times. So there will be no interactions between the HIV medications and the alcohols. Okay. Which are the common mistakes that can doing by the HIV positive persons? So missing a dose or stopping treatment, not reporting changes in the health, that means arising of the new symptoms, fail to report to the HIV positive doctors, HIV specialist doctors, poor diet, lack of exercise, alcohol and the drug addictions, avoiding support systems and the communities, and allowing the negative emotions to control their lives. So, if you have any psychological problems, please feel free to take help of your friends, families, or your HI specialist doctors. When should I change the HI medications? When viral load is not suppressed, when the side effect is intolerable, drug interactions with other disease medications, or food or the beverages, for simplification of regimes. Like previously, someone is taking the three medicines per day. The newer medication is available a single pill a day. Like previously, person has to take a medicines more than one time or three times, or the newer medication has to take only for one times. And previous medications, if older medications is interactions with the foods, and newer medications that doesn't have any problem with or without a food. So in this kind of the options are available. Person can change the medications. And whenever the newer medications is available with the lesser side effect or the more effectiveness, in that case, person should change the HIV medications. Uh, what is about the long-acting HIV injections? Or there is already injections are available in this world. That injection has to take bi-monthly. That means the if person is taking this injections on the 1st of January, then for next 2 months, January, whole January and the February, person should not take, no need to take any medications or tablets. But after on the 1st of March, person will again take these injections, and the two injections has to take separately on the one buttock, one injection on the left side of the buttocks, and the another injections on the right side of the buttocks. But these injections are not available currently in the India, and the cost of medications is very high currently. These injections are available in the America or the Londons, like the developed countries. But we can expect that after 3 to 4 years, this injection will also will available in India. So these injections will be alternative to daily pills, and in this injections, the two kind of the medicines are there. Effectiveness is as good as a daily taking the medicines, and it is a more convenient compared to the daily taking medicines. HIV and TB, it is a very go in hand to hand. What is the connection between the HIV and TB? So HIV weaken our immune system, so that those persons are more prone to develop a TB infections. And those who have already the latent HIV, latent TB bacteria virus in their body, there is risk that the activations of the TB bacteria and lead to TB disease. TB is a leading cause of death among the people with HIV globally, and that is a very significant issue. For prevention and treatment, it is crucial for all HIV positive patients to start HIV treatment by allopathic ART medicines as early as possible. Which are the specific concerns? Missed dose we are the humans, so and we may make mistakes and we may forget medicine sometimes. So, what you should do if you miss the medication sometimes? First of all, don't panic. It happens. We are human beings, so it is. Perhaps sometimes we can make mistakes. So, if you remember you missed your dose, you should take the medicine as early as possible, right away. And from next day onwards, you can take your medications as a normal schedules. But and let us take examples. If you are taking your HIV medications daily, one tablet at a 9 p.m. night, and if you remember your medications by tomorrow morning 9 a.m., then you can take that missed dose. But if time is more than 12 hours, then you should miss that dose, ignore that dose, and you should come back to your regular schedules from your next dose. When should switch the HIV medications? The possible different reasons we have already discussed that side effect and the newer medications available, better regimes, and the convenience. Uh, what are the research levels going on in the HIV field? So, very promising things are going on in the HIV research. The newer medication is coming that is more effective and lesser side effect, easier regimes. Long-acting injectables, we already discussed that we can replace the daily pills with the bi-monthly injections. Work is undergoing on the gene therapy that is potential to modify or eliminate the virus from the body, but it will happen or not, future will tell us. Another way I can hope from the broadly neutralizing antibody theory that will be promising the new approach to prevent and treatment of the HIV infections. And the cure research is going on, but for next 5 to 10 years, it is very difficult to be find any cure or the vaccines. So we have to wait for a few more years. Facing the futures. What is undetectable is called untransmittables. I will explain in details in these slides. So undetectables means the so little virus in your body that cannot be detected by the laboratory machines. And this can achieve by the consistent use of HIV medications, ART. What will be the benefits by achieving this U is equal to U? That will protect you from another kind of the infections. That will protect your partners from getting HIV infections if they are not already infected. This will help you to reduce your stigma and the anxiety because you will comfortable with that. Your immunity is normal, your viral load is under controls, you are safe, your partner is safe. Stigma and discrimination is a age-old theories, and still we cannot completely eradicate the stigma and the discrimination associated with HIV. But currently, it is less compared to the previous days. But you are not alone if you are HIV positive. There is a HIV communities, and currently they currently and uh, as per the calculations, the 3 crores and the 90 lakhs people are living with HIV, and out of them, the 3 crores people are on ART medications, and rest has to diagnose or on have to put on the treatments. So another worry for the all HIV positive patient is regarding the HIV transmissions. Will I transmit HIV infections to my partners or not? And how to prevent it? So intimacy and the HIV protecting yourself and your partner is a very important thing along with the HIV positive treatment. So can HIV positive persons have a healthy sexual life? So yes, HIV positive persons can enjoy a healthy and fulfilling sex life. For protections, using the condom is also important and all the times in all kind of the sexual activity. Till the persons achieve the undetectable viral load, that means the undetectable viral load means untransmittables. And that can be achieved only through the regular medications and with only allopathy ART medications. So you and sometimes the HIV positive patients need to do some lifestyles adjustment for well-beings. So can HIV positive persons go back to the work and do their work? So yes, HIV positive patients can work. HIV does not prevent someone for doing any kind of the job and for successful careers. So, what should I disclose my HIV status to my boss or not? Answer is your choice. Disclosure to your employer is not mandatory or not compulsory. Protected by law, the discriminations based on the HIV status is illegal, and you are protected under various kind of the by law. Another big in today's the modern world, traveling is a essential part of the everyone's lives, and many persons need to travel from the one country to another countries. So can HIV positive persons get a visa for their work or the for migrations or the permanent residency? So yes, it is a safe travel is absolutely possible with HIV, and most of country of the this world there is no any kind of the restrictions. Only few countries have some kind of the restrictions, and so more in the most of the countries like the developed country, it can be the America, London's or Australia's or many other developed countries, all European countries. You can get the visa for their for any purpose like the work for visitors and the permanent residencies. So in today's times, getting the visa, even if you are HIV, is not a very big deal. Only few countries have restrictions. But whenever you are going for the some trips, don't forget to bring your medications along with the prescription of your doctors and the medical stores bill that may you may require on the airport for checking. HIV and parenthood. You are not you are equally right to have enjoy your parenthood, and you can have a child. So what of will I get a HIV positive child or HIV free child, or in the process I my partner will get remain HIV free or not? This is also frequently asked questions by the many HIV positive patients. So absolutely having children is possible and safe with HIV and the current ART medications, the treatment or risk of the transmissions to the child is as low as the 1%. This is also theoretical risk. Practically, we are not finding any HIV transmissions from the mother to child if the person's on the allopathy ART medications with proper care, good adherence, and on regular medications. So preventions from mother to child is extremely possible, and the in world's few countries already achieve the zero HIV transmissions from mother to child. So if we take care about our treatments in our case, we can also prevent our future child free from HIV and also our partner remain free from HIV. What kind of the care you should take while delivery of your child? So early and the consistent ART treatment is crucial for the HIV positive mother or the partners that will help to prevent HIV transmission from the one person to the another person. So if high viral load is high, risk of transmission will be high. If viral load will be is low, then risk of transmission will be low. Which kind of the delivery can possible? The vaginal birth can also possible if viral load is under controls, but cesarean sections we can consider in the few cases whenever it's required. And after birth, infant should we also give some kind of the prophylaxis to the infants based on the depend of the durations of the HIV treatment for mother. If mother is on treatments more than 6 months, in that case the baby will get prophylaxis. Baby will get a prophylaxis for the 6 weeks. And if mother is on ART treatment on less than 6 months, in that case, the baby will get a prophylaxis HIV medications for more than the uh, on a 12 for 12 weeks. And what about the breastfeedings? Can HIV positive patients or mother can breastfeed her child or not? So answer depend on the situation from person to person. So it depends on decision personal and the complex situations. If fire load is not undetectable, risk is extremely low. But in still, if we cannot maintain the proper hygienes, in that case we advise the top feeding so, and breastfeedings. But those who are able to maintain the proper hygienes, in that case we will advise the top feedings. So for what is right for you, it is you should discuss to your doctors and that mutually both. as a you and your doctors can decide what kind of the practice regarding breast feeding will be best for you and your child. So I am completing my presentations here, and if you have any questions, you can ask here. And thank you very much.
Thank you
Is
so
there any
much, sir.
question? Yes,
Thank you so much, sir. Thank you for your overwhelming talk that you have shared on our platform and for making our viewers understand about such an important topic, for knowing them better about it, how they are supposed to take care of themselves, and which are the factors to consider, how to discuss, what are the side effects, and everything in detail. Thank you so much for that, sir. We have
thank you.
received few questions from the participants, so with all your due permission, I would like to put across those questions to you.
Yes, please.
Yes, just give me a minute, sir.
Yes.
So the first question is related to the best practices. So what are the best practices for managing HIV in special populations such as pregnant women, children, and the elderly?
Okay. For the pregnant women, the person, as every pregnant lady should undergo for the HIV testings, and ideally for the two times. First time is the when the lady got the means confirmations of the pregnancy report positives. Lady should go for the HIV testings, and another test after 3 months. So that will eliminate the possibility of the window periods during the first test. So early diagnosis for the pregnant lady, it is one of the most important things to prevent the HIV transmissions to the child. Second, starting the medications as early as possible, so that will reduce the viral load in the mother. So HIV virus can transmit from the mother to child in the three levels. First, during the pregnancy, and the second during the delivery, and a third is that during the breastfeedings. So to reduce the risk of the HIV virus from mother to child during the pregnancy, starting the ART medication is very important. And if the viral load is not controlled, in that case, the cesarean section should be off. And third, if a proper hygiene can maintain, a person should opt for the top feedings. And if a personal hygiene cannot be maintained for the baby's food safeties, in that case, the breastfeeding should be advised. Second, regarding the adult populations, and currently people who are HIV positives are living a longer life because the safer medications and the effectiveness of the medications. So, along with the HIV infections, the person has to face some another lifestyle related or the age related disease like heart disease, blood pressure, sugars. In that case, whenever person is taking any other medications due to any other diseases, person should inform the HI specialist doctors that I'm taking, for examples, I have a diabetes and I'm taking these medications. So can I take these medications along with the HI medications? So in that case, there is one wonderful online free software is also available, and mobile application is also available. So in that case, person has to feed up the name of the Mr. diabetic or any other disease medications, and along with HIV medications with only one click, person can know that is it safe to take this both medications combined or not? Should I take some change the medications or have to put a gap between the two dose? So all this kind of the drug interactions, it is very easy to identify by the patient himself, and if patient is not able to manage themselves, then can take help of the HIV specialist doctors. Okay.
Thank
Anything
you so much,
specific?
sir. Thank you for answering that question. We will move to the next question, and the next question is, what are the key considerations in managing comorbidities in HIV positive patients?
Okay. Most of comorbidities is happening because okay, one kind of the We can divide the comorbidity in the two parts. One is related to the weakened CD4 counts and the weaker immune systems, and that can attract the more infection in the body that is infective. And the second is already we have discussed the due to the older age, persons can get the diabetes, blood pressures, heart disease, and that. So initially to prevent the comorbidities like the infectious, we have already discussed the co-trimethazoles antibiotics that will help to prevent certain infections in the brains, lungs, and the guts. Tuberculosis prophylaxis will help isoniazid tablets for 6 months, and that will help to prevent the latent TB bacteria in the body to becoming the active TB disease. And regarding the diabetic, for all the routines, the comorbidity maintaining that and ART medication side effect monitorings, every TB HIV patient should undergo for certain the blood laboratory testings at the 6 months and the 1 years intervals to identify is there a problem along with the HIV medications or the age-related disease.
Thank you so much, sir. Thank you for answering that question. We will move to the next question. And the next question is related to the challenges and solutions. What are the challenges and solutions in achieving viral suppression in difficult to treat patients?
Okay. Viral suppressions we can achieve only with the regular ART medications because it is the virus and the multiplications life cycles of the HIV virus is very high. Within the few hours, the HIV virus can multiply from 1 to 2 and 2 to 4. So most of people are not comfortable with taking medications daily and on the right times. And people have their own limitations due to the job work. Like some people are working in the two shifts. For 7 days they are working in the night shift, and 7 days they are working in the morning day shift. Some people are involved in the traveling jobs. So for these people, the routine schedule is not very well structured. In that case, the very high chances that persons will miss the medications, and sometimes those who are like truckers, those who are not on right at the right place while the medicines refill at the time of the refillings, so they may not get the medicines at right times. And many people who are going outside from the India's for a few months or few years, sometimes some setups are not willing to provide the medications for longer periods. So these are the availability of the medications on times and taking the medications regularly on daily basis. These are the main challenges for the many HIV positive patients, especially who are in the traveling job or in the working shifting work. And sometimes those who are associated with the mental problems like the depressions, anxieties, and so those people are not fit. Physically and mentally fit to remember their medications on time. So those people need the assistance and the supportive hand of their family members.
Thank you so much, sir. Thank you for making us aware and for making us understand about this topic and for answering the questions of our viewers. Thank you so much. And
Thank you.
with this, we would like to thank all of our viewers for their ardent participation that they have shown by staying tuned with us. And thank you, sir, for your valuable time and for being here at our platform. Indeed, it was a pleasure to hear you out, and hearing it from your end was definitely a very insightful experience for every one of us. So thank you so much for that, sir. With all your
Thank you.
last comment, we would like to conclude the session here.
Yes. Thank you very much. I also enjoyed the talk to with you all guys.
Thank
Thank
you
you
so
very
much,
much.
sir. Thank you.